Hello everyone. Today we talk about the tracheal bronchus. It's me, Mazin. Our objective today, we talk about the etiology of the tracheal bronchus, the prevalence and the epidemiology, the clinical presentation of the tracheal bronchus, the image and mainly about CT and option of the treatment. The etiology and the prevalence and the epidemiology of the tracheal bronchus. There is a variable branching patterns of the tracheobronchial tree have been well described. One of the most important of this tracheobronchial tree branching is the tracheal bronchus, and when the anomaly of the bronchus arises from the right lateral wall of the trachea, usually less than 2 centimeters from the carina, and supply all or segment of the right upper lobe, this referred as the tracheal bronchus. However, various authors has used the term of the trachea to describe any anomaly in the bronchus derived from the trachea and the main bronchus supplying the upper lobe. There is many types, pairs of them. If the anomaly of the tracheal bronchus name supernumerary when the segment bronchus to the upper lobe exhibit a standard branching pattern 3 to the right and 4 to the left upper lobe. If you see here, this is supernumerary type, because if we go to the right upper lobe, we found all segments present, apical and posterior and anterior, and this is at 1. That is why which we call supernumerary. The others one, if absent or absent in one or more of the normal upper lobe segment bronchus, the tracheal bronchus will be considered as displaced. If you see here, this is the right upper lobe, and we have only 2 segments, anterior and posterior, and absent of the apical segment. That is why the apical segment is displaced into the trachea. This is the type 2. Type 3, which we call the big bronchus, or others name is the bronchus suis. This apply when the entire upper lobe is supplied by the tracheal bronchus. If you see here, this is all right upper lobe. It's being found in this area with the 3 subsegments in the right upper lobe: apical, posterior segment, and anterior segment. And this the type 4, which we call big bronchus. The others one, when this tracheal bronchus will end blindly, this which we call the tracheal diverticulum, you cannot pass the bronchoscope inside them. The territory ventilation by anomaly bronchus usually has normal vascular supply. This is a blind pouch, and this is a trachea, and this is a tracheal diverticulum. Okay, if you see here, also in the CT, is diverticulum from the trachea. The reported prevalence of the right tracheal bronchus range from 0.1 to 2%. The report frequency of the tracheal bronchus supplied by the entire right upper lobe, which we call the big bronchus, it's approximately 0.02%. Rarely, similar malformations has been seen in the left side. There is others, very rare. If you found bilateral tracheal bronchus, or this may be associated with the bilateral right tracheal bronchus in the setting of the right asymptomatic, and this will be talked in the another video. This is rare malformation during rotation of the lung, and you can found here, this is the trachea, and you found this is a bilateral tracheal anomaly. It's a bilateral tracheal anomaly. Clinical presentation: the vast majority of adult patients with the tracheal bronchus are asymptomatic, and the abnormal bronchus is discovered accidentally on CT or in bronchoscopy. The anomaly may become clinically significant when inhibit clearance of the anomalous bronchus lead to conditions such as recurrent right upper lobe pneumonia, air trapping, lobar or segmental post-obstructive atelectasis or bronchiectasis. And if you see, this is case presentation of the tracheal bronchus at Manchester University, and this 65 years old woman present with mild hemoptysis. CT is a very useful image to the diagnosed tracheal bronchi. Tracheal bronchi, as well as the presence of the associated finding, if this complicated by bronchiectasis or complicated by emphysema or bronchiectasis with anything, this is the best characterized by the CT. And there is a lot of CT option. You can find like multiplanary formations, volume rendered image, and virtual bronchoscopy. All these techniques allow to reconstruction of the CT data to produce three-dimensional image for the tracheobronchial tree. If you see here, this is a multiplanar. It's very clear to do. This is the trachea and this is a diverticular, tracheal diverticular. And if we do a 3D reconstruction image, you found this is a P1. Okay. Also, this is a reconstructor image on the CT, and this is a virtual bronchoscopy. Also, this can be done by CT. You see, this is the carina, and this is the right, and this is the left main carina, and this is a displaced types of the tracheal bronchus. Also, if you see here, this is a carina, and above of this is a big bronchus. If you enter here, you found the 3 right upper lobe. If you see here, this is a tracheal bronchus on CT. Small bronchus originated from the right upper tracheal wall, and this is on the coronal CT. Also, if you see here, this is a coronal CT. You found here, this is demonstrate the right upper trachea, and this arrow demonstrate this tracheal bronchus supply the apical segment of the right upper lobe. Also, this is the CT bronchoscopy of the tracheal bronchus. This is CT reinforcement with the volume rendered CT bronchoscopy or virtual bronchoscopy, and this will be demonstrate the trachea and the bronchial lumina that resemble view seen in the bronchoscopy. And this image show here is the tracheal bronchus, and this is the carina, and this is the right, and this is the left. Okay, this is the coronal 3D dimension external volume rendering image, show also the tracheal enter the right lung. This is the endoscopic view, a real bronchoscopy view, not virtual bronchoscopy, and also see there is some of the tracheal bronchus will be found there. What is the treatment option? The treatment option depend on or based on the severity of the symptoms and range from observation, and if the patients have severe form of infections or like hemoptysis or like this will be considered as lobectomy. And that is all. Thank you.